So welcome to the September 28th, 2023 regular meeting of the Human Services Advisory Board. I'm calling this meeting to order at 6:05 p.m. on September 28th. Thank you all for attending. We're going to do a quick roll call for the record of the board members in attendance. Yancy Arevalo.
Present.
Clayton Carlisle.
Here.
Sharif Cassis here. Monica Gonzalez will not be attending today. Joanne Parsons.
Here,
Gloria Quinn. Looks like
she's
there.
stuck on moped. She said that she's gonna be about 15 minutes late.
Okay, perfect. Thanks, Joanne.
Okay.
And then Courtney Welch.
Here.
Okay. And Mariana Zamora, non-voting member, is not going to be attending either. So we do have 4 members of the board, so out of 7 in attendance, so we do have a quorum. So item number 3, citizen comment period. Staff, is anybody in person, online, or by phone ready to speak on citizen comments?
No.
Oh, so no citizen comments. Item number 4, the minutes for the September meetings are not yet available. So we're gonna have to push that back again to the next meeting. And we're gonna go on to our presentations. We're gonna receive a 5-minute presentation by each applicant agency for the program that was listed on the evening's agenda. Each agency will receive a 30-second warning as the time limit is approaching, but the time limit is flexible. Each presentation will be followed by a 10-minute question and answer session between the boards and the agency regarding the program and the application. Members of the public are welcome to listen to the presentation, but will not take part in the discussion or this questions and answer period. Each program will receive 15 minutes total for presentation and question and answers. Being that I'm a voting member of the board, and I'm going to devote the attention to listen to the presentations and discussions. So staff will introduce the presenters and track the time. So Zindi, go ahead and go with our first presenters.
Okay, our first presenter is Hays County Child Protective Board. The program is Hays County Child Protective Services, and our presenter is Mary Cobble.
Hello, can you hear us?
Yes.
I'm Mary Cobble, and I'm the treasurer for the Hays County Child Protective Board.
And I am Karen Housewright. I am the secretary of the board, and I am also the chair of the grants committee. For those of you not familiar with the work we do, we are a 15-member all volunteer board. Actually, we have 1 vacancy currently, so 14 of us meet on a monthly basis to cover business, and we'll get to most of what we do during our business meetings shortly. But we come from all over the county. We all are Hays County residents. I'd say about half of us are residents of San Marcos, and we also have representation from Kyle, Buda, Dripping Springs, Wimberley, and Driftwood. We are commissioned by the county commissioners. They have to give us their final approval, and every year we go through the process to be reconfirmed, is that the right word, Mary? So we are here to support and supplement the work being done by CPS in Hays County. And we provide that support in a number of ways. Much of it comes through our Rainbow Room. And Mary is going to share, if she can, some photos of the Rainbow Room to give you a feel for what takes place there. Can we share the screen? Yes.
So I think you have to make them panelists for them to be.
All right.
Yeah, they're panelists.
Our biggest funding is used to help meet needs of abused and neglected children who are clients of Child Protective Services. Often when a caseworker goes out to investigate an abuse case, she or he ends up having to immediately remove the child from the home. And in that case, very often the children are malnourished and they are dirty and they are scared. And the Remy Rainbow Room is a 24/7 facility. The caseworkers have access to it. And in that facility, you see there are 2 bathrooms. One is aimed at serving the needs of a smaller child, and the other is aimed at the needs of older children and has a shower in it. This is the one for the small children. This is the distribution area in the Rainbow Room, and in it, you'll see we've got hygiene products, we have car seats, we have baby beds, we also have toys, we have blankets that can really comfort a child. Over here in the back, you see backpacks, and these are packed by gender, by age, and they're like an overnight emergency bag. And these are ready for caseworkers to grab and go. The Rainbow Room also has a play area, and this is used a lot when it lets the kids a safe place to be. We also, and I'm gonna unshare. Oh, okay. We also help identify needs of these very special children through in our monthly meeting, at which time the CPS caseworker presents special requests to the board, and we've got a sample of one of the requests here.
So every month when the board meets, as I mentioned earlier,
30 seconds.
I'm sorry,
They're doing,
okay, sorry. We consider requests from CPS. This is one such request, just to get you an idea of what the board looks at every month. And every month we can have anywhere from 10 to 35 such requests that we review, and we require specific information. We never get the last name of the child, just the first name and the age. We're told what kind of placement the child is in and the level of care needed. I'm happy to go into more detail about what those terms need. But in essence, it tells us who they need a check written to and for what amount and what the purpose is. We have questions we ask the caseworker, and this is really, we are often asked this information in grant applications, so we try to collect what information we can. Beyond that, that is confidential. We do not ever know the identity of the kids that these requests represent. And then the caseworker gives us a little bit of information about what the need is for, and maybe a little bit something about the child. In this instance, Kevin had been struggling academically, but has greatly improved his grades, and he's hoping to be able to play basketball. So we review these, and then we vote as a board either to approve or to not approve the requests. And that's what we normally do during our monthly board meetings. Can I explain in any more detail what these requests, what it's for?
We actually have to move on to the question and answer period, so if.
Okay. What else, Mary, do we need to cover? I think that's basically what we do. We have the Remy Rainbow Room. We also consider these requests on a monthly basis. Another thing we do is support CPS workers wherever we can. That includes providing money for them to attend training. That would be funding above and beyond what the state is allowed to cover. So we do that. We pay for summer camps. We pay for tutoring. We pay for bed frames and mattresses and cranial helmets, if you can imagine that. And just a wide range of needs that these kids have that there's no other funding for.
Oh my goodness. Okay, yes, I just did, and I can see the meeting has popped up. So I'll log out. I was just gonna send a couple of emails, so I need to be off anyway, so.
We've lost you.
I'm just gonna leave the webinar. Assign a new host. It must have defaulted. That's so. Oh dear. What to do? Okay. I think I'm not gonna mess with Zoom. I'm just gonna log out of my city account. Oh, funny. Okay, I'm just signing out, and hopefully.
Well, I am now the host for some reason, friends. I would love to give it to somebody else. I'm here to present. I'm with Communities and Schools of Central Texas. So I don't think I'm intended to be the host. I am working right now. I have a 6-year-old son who just got back from soccer immediately at the moment where I was made host. Okay, do you all want me to make someone the host, or do you want me to hold on to it until someone else comes in?
I'm not sure, but I did have a question for the previous agency, and I believe you are not with the previous agency, correct? Your Community and Schools?
I am.
Okay, thank you for stepping up. And on behalf of the board, I apologize for that. It seems we might be having some technical difficulty. But for the two ladies who just presented, thank you so much for your time. And I did have a question. Are you guys able to hear me?
Yes.
Okay. What is the typical age range? I know you said you asked for first name and age, and you did a variety, or said a variety of check sizes. Go ahead.
We serve children ages 0 to actually, they age out of care at 18, but the state has a program where they can elect to stay in care, and that is up to age 20. I apologize. I think it's age 21 that they can elect to stay in care. Think about it. These kids are 18. They have no real family often, except for the substitute care family. But the age range is probably is newborn to 21.
Okay, got it. And so for these children, are you usually writing one-time checks? And if that's the case, can you give me, I know every kid's gonna be, a different check size, but is there kind of an average
That we spend per child?
per child? Yes.
Okay, what we have, and I think it's in your packets. We included the we call it routine funding allocation guidelines, and it covers typically what we'll give for initial clothing allowance, for milestones. Okay. Do you have that in front of you? And holiday gifts, and then we do a back to school clothing program. It's not for supplies, it's for clothing, because so many of these kids, when school starts, they got very little. And
yes, I guess I was asking more along the lines of like emergency funding. So we see how much on the application that you're planning, but I guess what would be a situation outside of those circumstances where you guys would be crunched for money, that benefits San Marcos as a whole for the community, but also, of course, for this child.
Interesting question, and I think it's hard to answer because there's such a variety of requests that we receive. Anything from, as Mary pointed out, the basic allocations that we give out when a child is initially removed, to something much more specific, like the cranial helmets, which are $1,500 each. So, that's a really tough question to ask. We don't know each month until we get to the meetings what we'll be reviewing and hopefully approving. I would say that fortunately, in my experience with the board, I've been on the board for 3 years now, that we rarely turn down a request. It's often turned down because we need more information from the caseworker or for some other reason, but we have been able to fund most of the requests that have been presented to us. I'm sorry.
Okay, perfect. No. I mean, you answered my question. I wanted to know, like, in those extraneous cases, if you guys had a budget amount where it's like, you know, the cranial thing, you cut it off at 20,000, kind of what that process looked like?
Well, typically, you know, throughout the year, we adjust, we start out with the budget, which is always based on prior year. What were the needs the prior year? And then over the year, we'll adjust that budget, and we may have a medical request that's gonna exceed the original budgeted estimate. So we'll know we'll need to take money from somewhere else, but typically we can provide for that. Because one year we may have a great demand for rental assistance, and the next year that might be down, and we'll have a bigger demand for educational needs. It is variable, and your question is a good one.
And I think rent assistance is a good example of something that really escalated dramatically during COVID. There were a lot of people, you know, either lost their jobs or were put on furlough, and we saw quite a spike in requests for rental assistance.
And I think what sets us apart is we're not the long-term solution for a lot of this. We are the emergency solution. We can get it done quickly, whereas long-term rental assistance is someone else. It's not us. We do it for a week or 2 weeks while the family and the caseworker can look for other funds.
Perfect. I think that's all the questions I have. And that actually, I'm not sure who is there anybody keeping minutes?
Well, this is being recorded, but the host came back.
Okay, perfect. I'm done with my questions.
Thank you. Well, I would like to say, if any of you would ever like more information, we would love to talk to you for as long as you will listen. And if you ever would like to see the Rainbow Room, we are just really proud of it. It is the result of many years of really hard work, and it's needed and used. And anyway, just let us know. We'll love to meet you and show you around.
Awesome. I'd love to see it.
So I'm serious. Just let us know.
Okay.
And thank you for your time.
Yeah, no problem.
How many questions were asked while we were away?
I asked probably like one, but it was kind of like 2 or 3 in the middle.
So we didn't miss much on this side then?
I don't think so.
Except we saw like.
I got it. Yeah. I got here. Can I ask a question?
Yeah, go ahead, Gloria.
Oh, okay. So, well, I like the fact that they certainly gave a lot of data, a lot of numbers and statistics, and it was very detailed what they lined out, and I find that helpful and informative. I so the this might be a silly question, but in the budget section, the revenue is equal to the operating expenses. I guess as long as they get the donations and the funds that they're anticipating that they ask for. Am I right on that? That right now your books are kind of balanced as far as your intake versus the
Yes,
operating?
we do start the year off with a balance.
Okay.
So the budget reflects the income and expenses that we anticipate for the next year. But yes,
Are you successful at that most of the time, or what?
we have been the last. Yes, we have been. We have an incredible board of volunteers, and they work really hard, and we seek out funding anywhere we think we can find it, because the need is tremendous. The state and federal government, there are so many gaps in support for these children. And we are just determined that if at all possible, we'll fill those gaps.
No, you've certainly sought after a number of funding resources other than us and whatever. So that's great. Not every agency is.
Well, each and every we value every donation because it translates into a service or goods that we can supply. And I think when you see, I've been at the Rainbow Room when a caseworker comes in to pick up a toy and new clothes for a 4-year-old's birthday. And, that's not a lot of money, but that is a huge, huge event in that child's life.
Oh, yeah.
And
anytime you
so
make up for what's going on.
So it's it's everything from a small gift like that to the child that was sent to Virginia. She had mental health issues. Y'all probably realize that mental health facilities in the state of Texas are abysmal, especially if you need long-term care. And we had a severely abused child, and the best care she could get was in Virginia. And we were able to help with that. Not a lot, but some. And she's a Hays County child, and she needed help. And so
so you had to send her out of state.
Yeah, so it's big money sometimes, and sometimes it's that birthday present, but they just it means a lot to these kids.
So if you do, if you're taking as much as your expenses, and you're asking for $25,000, where would you put that money? What would you do with it?
I think most of your money, I'm sorry, I have to look back through.
Like you got extra, I guess. I don't know. Not a bad thing. Because I don't think we're listed here. Hays County.
Yes, we use it for emergency food and housing, for unpaid, for medical, dental expenses, and then clothing. We spend a lot on clothing.
Yeah, I just wanted to know, if you had a little extra, if you had a little extra, where's the need? That's all, just wanted to know what the most need is.
If you're asking if we got extra money, what would we do with it?
Yeah.
I think we would increase the inventory at the Rainbow Room, maybe be able to stock some supplies that right now we can get, but the caseworker has to request them, and it's a special request, and there's a time delay. Beds come to mind. We don't really stock we stock a lot of cribs and pack and plays, but the bigger beds that the bigger kids need, we can't stock those. And so I think if we had extra money, it would be items like that we right now people have to wait on. And if we had extra money ever, that is one thing that we would look at, would be expanding what we can stock in the warehouse.
Well, and I suspect it varies from year to year, what need you probably have to borrow over here to make up over there for,
Yes.
bedding versus emergency food might, 1 year. I was just curious if there's a couple of pots that you would like to, build up a little bit to help.
We have one board member that has a dream that we can give out scholarships. So she's really dreaming big.
Okay, so, Clayton has a question, so we'll move on to Clayton real quick.
Thank you, Sharif. Ladies, thanks for all the work that you do. I just wanted to ask, you said you want a long-term solution for these kids. So like on average, what's the number of days that you would you spend on each case?
You mean the number of, I'm sorry,
Like the amount of days you have contact with the client?
CPS might be a better source for that information because we do not really have a lot of direct contact with the children here. It's usually the CPS worker who comes into the Rainbow Room to collect items, sometimes to bring the child for a bath or a shower, as Mary mentioned. Other than that, our contact is really through the request forms that we see. So to my knowledge, it's rare that we consider a request for the same child more than once.
but if you would like to know how long is a child typically in care, I could find that out and get back to you.
Yeah, that'd be great to have information. I appreciate the clarification.
Okay, perfect. I think we're running long on time.
Yeah.
Any other questions at all? Gloria, we good? Okay, Joanne? Good. Okay, well, thank you very much, Mary. We're gonna go ahead and move on to the next one.
Great, thank you so much.
Thank you all so much.
Thank you.
Thank you. Our next presenter is School Fuel. The program is weekend food for hungry children in the SMCISD school district. Presenters are Diane Breedlove and Michael Pig.
Hello, I'm Michael Pig. Can you hear me?
Yeah.
Good deal. I'm going to share my screen with you. Diane will not be joining us tonight. It's just me. There we go. So we are School Fuel. And we are a program that sends home food sacks on the weekend with kids who have food insecurities. Our mission is clearly stated. School Fuel's mission is to provide the fuel for a better learning environment by removing the pangs of hunger among the students in our classrooms. Currently, we serve 1,200 children, but what we discovered about 10 years ago was that we had a group of retired teachers who got together and said, when I was teaching, I discovered that on Monday mornings, students were coming to school and they really hadn't had enough to eat over the weekend. They were coming to school. Sometimes they were missing school because they weren't well. Sometimes when they were at school, they had a tummy ache and were headed to the school nurse way too often. They were also had a lack of focus, and so their grades suffered as a result. And oftentimes, because they were hungry, they had behavioral issues. And so they requested an opportunity to do a pilot program at Mendez Elementary. And the principal gave permission to do so. And they, for 36 kids, they provided a weekend food sack, so that those kids had at least 10 items that they could tear open with their own little fingers, that they could take care of, and they could they didn't have to cook it. They could easily access it. And they tried to do a menu that had as much protein as possible, so that through the weekend they had some sort of nutrition. They consulted with some folks at the university here in town to kind of put together a menu that they thought kids would eat and that would provide, some nourishment to get them through the weekend. They discovered that after a semester of doing this, that absenteeism was down. The kids were coming to school more often. They were taking less trips to the school nurse, and their focus was improving, and their grades were as well. And that they weren't seeing as many behavioral issues in the classroom from these children, which meant that the teacher got to spend less time working with classroom management issues and more time in instruction, which is a benefit to every student in the classroom. So in 10 years, we went from 36 students to 1,200. We now currently serve, this last week, we sent the third of 38 sacks that we will send home. We send home a sack every Friday of the school year. And when we have a long weekend, like the Christmas break or the last day of school or spring break, we send home an extra sack. We call them the special sacks. And so by the end of the school year, we've sent 38 sacks home with 1,000 students who are in elementary school and middle school. But the other 200 kids that we serve are served through a pantry at the high school that is in its second year of operation. We've only just begun that program, and it's sort of an experiment, but it's been going quite well. And so we're sending 38 sacks of food home, and it costs us roughly, historically, it's cost us about $215 per student for a school year to send home a 10-item sack every Friday of the school year, 38 times. And so we've been able to be quite frugal through a partnership with Labatt Food Services and an umbrella program called Snack Pack for Kids that originated in the Panhandle of Texas, with some school food programs, some weekend supplemental programs that we managed to get umbrellaed under. And so we get a good pricing from Labatt. Recently, it's been harder to keep that $215 budget. It's more like $225 at this point. And so we've seen because of just the cost of food has gone up. And so we're having to increase our budget to meet that, even as we add students. We've added students for the 10 years that we've been in service. We've added about 100 students per year. And so we currently serve all 11 SMC ISD campuses. That means that we serve every elementary. Yes. Okay. We serve every elementary school. We serve both middle schools. We serve the alternative campus at the Lamar building. And then we serve the high school now. And we are 100% volunteer organization. That means that our entire 7-member board of directors is all volunteer, and we are able to put to work about 40 volunteers per week, packing sacks, doing food prep, receiving food from Labatt. We are housed in Mendez Elementary. Currently, the school district values the program enough that they've actually given us floor space. And so we're there in that Mendez, what used to be the locker rooms, but since it's an elementary school now, it doesn't get used as locker rooms. It was locker rooms for Goodnight when that building was Goodnight, and so they've been vacant. So they've cleaned them up, and we now house food and volunteer space for packing those sacks and distribution. I can answer some questions about how we get that distribution happening. I imagine you have some, but I think my time is probably close to up. Would you like to hear how we accomplish that?
Yeah, the floor is open for questions then.
So I should continue? All right.
Well,
ahead.
Okay, so I heard you say the second year for the high school program. So the high school program, there's 38 high schoolers?
Currently, we have a budget and we've made plans through a pantry that we have there on campus. So that the students have some agency in it. They can select the food if they want to. There's a menu.
Like little grocery
and they
store?
can choice and we treat it like a store. It's still quite experimental. And there's some dignity issues, honestly, with high school students. Elementary students are happy to receive a sack of food. But high school students, there's a little bit of a, embarrassment associated with needing that. And so we're figuring out the best ways to be discreet and to offer them some agency. We have a great deal of help from administrators on that campus, Dr. Cunningham in particular, who is there serving the campus as a secondary ed coordinator, trying to help kids realize that they could go to college if they wanted to. He's also,
Have you guys thought about potentially, sorry to cut you off, but just potentially putting QR codes like in the bathrooms? That way, it's private. They're already in a private spot and people are used to scanning those codes, and it could be as simple as a Google Doc, like a Google form sheet.
Currently we have.
Of course. Go ahead.
No, I was saying currently we have a menu that is accessible to them through their school status. They can get a private text message that they receive from a staff member at the school who sends that out to them. But that is a great idea to put a QR code in the bathroom, because if they could, order their food sack digitally, that might, that's even less time that they have to spend FaceTime, in any kind of humiliation.
Right, to get rid of the awkwardness.
Yeah. No, that's a good idea. Thank you. We had not thought of that. That's that might be a next step for us. Thank you.
No problem. Yeah, you could keep the sacks in like the front office, so it could be something they,
Certainly.
I got to grab something from the front office.
Certainly.
Type thing.
Clayton, you had a question?
Yes. I was just wondering, what's the average composition of the sack of food you give out, like food groups and things like that?
It's all shelf safe. It typically we have let me walk down the line assembly.
It's in the handout.
And we put two boxes of chocolate milk that has about 9 grams of protein each. And then there's fruit cup, there's granola, there are beef sticks, there's peanut butter, there's applesauce, sunflower seeds, 2 different types of cereal, and peanut butter, cheese and peanut butter crackers. Uh-oh.
Awesome. I appreciate
We
that.
just stopped the screen sharing so we can see everybody on camera.
Oh, sorry about that.
Okay, you got it.
Did that answer your question? I'm sorry, Clayton.
Yes, sir.
All right.
Are you guys working with a dietitian?
Yes. Well, we have in the past. We are not currently. We've kind of squared those menu items, and what we were informed was that obviously they need fiber, they need carbs, but if we can pack as much protein into it as possible, that's what we're trying to do.
Gloria, you had a question?
Yeah, so where does this number 38 come in? Because I'm seeing huge numbers here of what you're supplying.
38 sacks?
Yeah, where's that number
So
come in?
38 sacks times 1,000 children is 38,000 sacks per school year.
Okay.
Yeah.
I was wondering about that.
Yeah, so 215 times 1,000 kids is about $215,000. more like 225 at this point, plus another 200 that we serve at the pantry level. And that costs us almost $230 per kid in a
Right.
year. And we serve currently 100 freshman students and 100 sophomore students.
Okay. And this is just the SAC food, right? That's not the free or reduced lunch program and breakfast arrangements, is it?
No, this is they can grab this sack of food from their parent liaison on their campus, and they can get it every Friday. At the elementary
Okay.
level, it's put down in their backpack for them so they can carry it home, and they have it when they get there. At the high school level, they swing by and pick it up. The fifth graders often swing by and pick it up, and the sixth, seventh, and eighth graders all have a designated point where they come by and get it.
Okay. And it says that the district provides free breakfast and lunch to every student in the district, meaning Hayes and district, define district.
San Marcos Consolidated Independent School District.
Okay, specifically San Marcos.
Yes, it is.
Okay, wow. All right. Thanks.
Absolutely.
So I have a couple of questions, actually. So with the potential government shutdown coming up in a week or two, how's that gonna affect your funding or your program stability and
Yeah.
reach?
Currently,
Good
it won't affect us at all. Most of our $215 per kid comes from little old ladies in the neighborhood. We get a lot of checks from people in San Marcos who want to support this program. The school has supported us. We have teachers who give to it. We've gotten some grants through faith-based opportunities. We've gotten some grants through government agencies, but most of our grants come from community partners. You can imagine that it's a chunk of change to buy 38,000 paper sacks with school fuel stamped on the side of them that we roll up and put into the backpacks of kids. But we don't pay for that because Barry Aviation said a long time ago, we'll buy those sacks every year. And we don't deliver them to the school, so it doesn't cost us gas and all those sort of things. It's all volunteer. Sometimes it's a crew of pickup trucks that come by the school, and I load bins in the back of their truck and they take them to each campus. And sometimes, many times, most of the time this semester, in fact, Ace Relocators, who is a moving company here in town, brings a big truck. They send us 3 people and they deliver all of them and then return our bins empty to us. And so we just have a lot of community partnerships because people really have gotten behind us. For 10 years now, we've been raising these funds. It's about $300,000 that we'll raise this year. I think our budget is $290,000, and that will serve next year's school year. We don't make a commitment to deliver on the number of sacks we're promising until we have raised the funds to deliver that many sacks. So we're always raising money for the next school year. So we're trying to raise $290,000 for the 2024-2025 school year. Currently, we have covered the cost of this school year. We need to cover the cost of next year. And I don't need to tell you that kids aren't getting any less hungry.
So a follow-up question on that, how do you expect the demand to go up if something like that comes through?
Well, we know that there are a lot of families in SMC ISD who depend on a hot lunch for their kids. And so whenever we have a long weekend, whenever we have a school outing, we know that there are some kids those families struggle. We see that struggle intensify toward the end of the month when resources begin to run low. And so we've seen just in the short period of this semester, as we got to the end of the month, we saw the numbers that were being requested by each campus go up quite a bit. It means parents are asking for it. They're asking for that help. And so we anticipate that it will only rise. We have capped it we set a limit of 1,200 sacks. Currently, we are fulfilling that to about 90%, and we are only in the the first month of school. And so we imagine that we will hit that limit very quickly, and we're prepared to sustain it through the entire school year. But we imagine next school year it will only go up. So.
Okay.
Yeah, Courtney.
sorry.
Hey, go ahead,
Okay.
Courtney.
No, I asked earlier if you guys worked with a dietitian, because I think it's very important. My fiance is actually a dietitian, but we're working with, or you guys are working with kids that are in elementary school, and sending home like different type of processed meats. And I understand the shelf stability, but what about the sodium that's in this food, like for a kid of this age, and the like addictive properties that are there? Is it possible? Have you guys, talked to a physician about doing Ensure, something that, covers a more well-rounded diet, because otherwise, my concern is just, there is a problem with children becoming obese, and I know these are kids who aren't getting enough food, but that means they're also not getting enough nutrients. And the protein is important, but then there's other fallbacks that come in Slim Jims and things like that. And I say this as a kid who got those. I went to Boys and Girls Club and got those stacks.
Sure.
Growing up.
Yeah, we've worked with, obviously sometimes the best product, the one with the most nutrition, isn't always available, and certainly isn't always available in our price range.
Right.
Yeah, and that is why poverty creates this problem of obesity, is because, and so we're very aware of that. So we do our best to get the product that has the lowest sodium, the highest proteins, the least amount of sugars,
caloric density.
But we have at the end of the day, we know that if we sent home broccoli in a sack, kids aren't going to eat it. So, trying to figure out that whole thing is it's a constant chore for us. We take that seriously. We get feedback from parents, from parent liaisons, from counselors, from nurses at the school, administrators on those things. We wish that, we could have. There's obviously more to this program, but in the end, we're hoping, our hope really is that, because we know the sack of food is only going to last as long as the sack of food lasts. But if they can come to school on Monday morning, not having been totally deprived of nutrition, that maybe they'll be able to pay attention, and the education they get as a result will be the thing that brings them up out of poverty. The sack of food will only last as long as it will. And so we try to stick with that mentality, and communicate that to the school partners. And so our parent liaisons take seriously their responsibility to help connect parents to resources that teach nutrition, that engage their kids for nutrition. And so really, we like many programs like us, we are unable to have a personal relationship with each child, but we are resourcing a relationship that hopefully is leading to an education that will pull them out of that poverty cycle.
That is a perfect, that's exactly what I wanted to hear as far as like the bigger picture, the bigger picture.
Thank you.
But yes, I totally understand.
Yeah. Good question. Thank you.
No worries.
Okay, any other questions, Joanne? No? Okay, I think we should be good. Gloria, questions? No? Okay, cool. All right, Michael, well, thank you very much for your time. We're gonna
thank you so much. We appreciate your support. Thank you for your time.
Take care.
Thank you.
Okay.
Our next presenter is the Country HDD Center. The program is Mobile Crisis Outreach Team, and our presenter is Anthony Nguyen.
Hi, everybody. I'm gonna pull up a PowerPoint here. Okay, can you all see that?
Yes.
Okay, so I'm with Hill Country MHTD Centers. I was gonna have a co-presenter today. Unfortunately, Amy Lowry was not able to make it. But I'm excited to share with you what our Mobile Crisis Outreach Team does. So I'm going to quickly run through just an introduction of our organization, and then a overview of our MCOT mission, go over some data, and then a quick summary for you all before questions. So as an introduction, I am the Director of Clinical Operations for Hill Country MHTD Centers. We operate as the local mental health authority for Hays County and 18 other counties in Central Texas. We serve a variety of larger and more frontier rural counties. And Hays County is currently the largest county that we serve. As part of our mandate as the local mental health authority, we provide crisis services in each of our counties, including here in Hays County. And as the provider of crisis services, we operate 24-hour on-call service that in Hays County is manned by our Mobile Crisis Outreach Team. The goal of the Mobile Crisis Outreach Team is to provide an immediate response to individuals experiencing thoughts of suicide, thoughts of homicide, or psychosis to assess condition, assess the least restrictive treatment environment, and provide needed intervention. So often what we are trying to do in situations where we are providing an assessment and an intervention is trying to figure out what is the least restrictive environment to help this individual in a safe way right now. And we do that using a variety of evidence-based models, primarily the Columbia Suicide Severity Rating Scale. Often we are called by local law enforcement to provide an assessment, as well as local healthcare providers, hospitals. We do have individuals and families also call us, and we provide assessments at their request as well. Just some data from last fiscal year. So in Hays County, our Mobile Crisis Outreach Team served 774 individuals. 319 of those individuals were San Marcos residents, so right around 41% of individuals that we served in crisis were residents of San Marcos. And for those individuals, we provided 2,029 services in total. 858 of those services were to San Marcos residents, which is right around 42%. These services include follow-up services. So when we provide a crisis service, we also provide follow-up services during a span of 7 days to ensure that an individual is connected to a longer-term care option, whether that is with our clinic or an outside resource, in order to help prevent someone from going back into crisis. Here's a breakdown of those San Marcos residents. 169 were women, 150 were men. And here's just an overview of what kind of age grouping we have for those individuals served. And what really sticks out is this 20 to 24 range. We see a spike there, and then we see those numbers start to decline. So, as I stated earlier, our MCOT team provides necessary emergency intervention in an effort to improve outcomes during crisis situations. San Marcos has the largest concentration of these services within the county and is home to the MCOT team. So our MCOT team is actually stationed in San Marcos. Local funding from this grant opportunity would help us to expand the MCOT team's depth, allowing us to provide more services that are geared toward prevention of crisis, ultimately leading to improved outcomes for residents. I do want to also add that one of the things that we strive to do as a team is reduce costs to the community. So for instance, often what we're trying to do in crisis situations is trying to keep that individual at home safely. And so we're working with the family, we're working with the support system to try to develop a safe plan for that individual. We're also working with that individual to be part of that plan. And each time we're successful in that, it is saving the community money in the form of transportation costs. If we are able to develop that safety plan and connect to long-term treatment, it can also reduce costs to the ER, which is often where individuals in crisis present. And then most importantly, in that situation, it leads to a better outcome for that individual. There's a large evidence basis for care in the least restrictive environment, in the home, in someone's community, being the best place to receive care and really resulting in the best outcomes. With that, I'm sure my time is probably running close to being short, so I will stop sharing my screen and open it up for questions. I tried to talk fast. I hope I did well.
I don't want to hog the question, guys. So if I have questions.
Go ahead, Gordon. The floor is yours.
Okay. Okay. So let's say I'm a person in crisis. How do you guys get in contact with me? Or how do I get in contact with you?
So we have a 24-hour crisis line that individuals can call. So an individual who's experiencing a mental health crisis can call it themselves, or a family member can call it, a hospital social worker can call it, a law enforcement officer. So it's really whoever's there to help facilitate that phone call. We do also have individuals call themselves as well.
Okay. And then how many employees do you have? And I know you said you were going off the University of Columbia's guide, but are the employees that you have currently who are making these phone calls QPR certified? Or what kind of training are they? Basically, I'm asking, are they qualified to talk to someone in such a high risk situation? And if so, is there any evidence of that shown?
Yes, so that's a great question. Currently, we have 4 staff who are QMHPs, so qualified mental health professionals in the state of Texas. In order to be on our crisis team, they have to go through a pretty rigorous training. And that training process includes the ASSIST training from LivingWorks, which is what the National Suicide Prevention Hotline utilizes. So they have to complete that training. In addition to that training, they also have to go through a pretty rigorous shadowing process and a fidelity testing process with our licensed staff before they're given the green light to handle any situation one-to-one. once they are greenlit to provide a crisis service on their own, they also still have 24-hour access to a licensed clinical consult. And before a disposition is made, they call and staff that case with the licensed clinician. So for instance, if they are working toward a safety plan with an individual at Christus Santa Rosa, they are going to call a licensed clinician. I'm actually on that rotation for the licensed backup, and we're going to talk it through to ensure that that is truly a safe situation and that we haven't missed something.
Okay, perfect. I guess I just want to say congratulations on working with 18 other counties, and we appreciate San Marcos being the majority of those of the, you know, our community that you're helping out with that. I feel like I'm question hogging, so.
Which sets up my question perfectly. Thank you, Courtney. Since you have 18 counties, why is San Marcos up to 41% of the total use of this organization?
That's a great question. So the numbers that I showed were actually Hays County. So San Marcos is 41% of the crisis services in Hays County, not all 18 of our counties.
Okay, gotcha.
Gloria has a question.
Gloria, go ahead.
Yeah, could you repeat what you just said, the clarification about why it's 41% in Hays County? You answered.
Yes, so the total numbers that I showed was all of Hays County, and then 41% of that total Hays County is San Marcos. So I'm not looking at the entire 19 county catchment area with those numbers.
Okay, all right. And I think he asked why is San Marcos, that seems high for, you know, little old San Marcos.
That's a good question.
Poverty rate, you know,
well,
I don't know. I
actually think there are several factors there. So it's one of the more populous areas of Hays County, but I don't think that explains the full picture. I think San Marcos actually just has a better infrastructure for facilitating some of these calls.
I see.
And so for instance, we have a great partnership with Christus Santa Rosa and with San Marcos Police Department and Chief Standridge over there. And so I think that the partnerships in San Marcos are strong, and that results in a lot more individuals in crisis being on our radar.
Yeah, identify it. No, I get
Exactly.
that now. That makes sense. So is there a psychiatrist on your staff? There has to be. And when you say and is he on call? Where does his salary or her salary come from? And you mentioned that you have on staff 4 qualified mental health professionals. Are these social workers, or what is their, you know, official title? Just.
Yeah, so some of them are social workers. They meet the state criteria for qualified mental health professional, which is a bachelor's level.
Like an intake worker, like an intake worker, like if you walked in and they collected the data, but they're not social workers, they're just kind of like.
They all have formal training in crisis intervention care. So they're not necessarily data entry staff. They are fully trained and qualified to participate and lead these interventions. We do have psychiatric physicians and nurse practitioners on staff. We don't include them in the MCOT budget because typically in these situations, we are not prescribing meds. Rather, we're connecting with a prescriber, whether that be in our clinic or at an inpatient mental health facility. That said, one of the things that we are looking to do more of is utilize a contract service by the name of FastPsych to facilitate expedited psychiatric evaluations as an extra way to be able to prevent hospitalization. And so that is actually part of our grant application. And we're hoping to really expand that because I think that can help us prevent some otherwise unnecessary inpatient hospitalizations.
Okay.
What? Oh, I'm sorry, Gloria. Go ahead.
Yeah. So, what are the more? What is a typical call consist? What I guess what I'm looking for is what are the more common occurrences that you get? Because usually the common is common, and the crisis is not very too much.
There's quite a bit of variance, but there are some common themes.
What?
There's quite a bit of variance overall, but there are some themes in that suicidal ideation is the most common reason for initiation of a call. The majority of those calls are coming from Christus Santa Rosa or from local law enforcement to have us help assess the situation and make a recommendation, as well as help facilitate that recommendation.
Okay. All right. Domestic violence. Yes, no.
That is sometimes a factor in that suicidal ideation. We don't typically get involved until suicidal ideation or homicidal ideation or psychosis is a factor. Outside of that, it typically will stay with local law enforcement. But there are a fair amount of calls where domestic violence has resulted in suicidal or homicidal ideation, or has been due to decompensation, psychiatric decompensation, and then we get involved.
Okay. So you go out to the home?
Yes, ma'am, sometimes.
Okay. All right. And the most common need is suicidal or homicidal ideation.
Yes, ma'am.
And then somebody determines if they're safe, or because that's almost the criteria now for any admission into a psych hospital. You could be psychotic as the day is long, but if you're not at risk for harm to self or others, it's pretty pitiful about what you can actually do.
Yes, ma'am. For psychiatric decompensation, hospitalization on an involuntary basis does happen, but you're correct, it is more difficult. In those cases, what we're typically doing is assessing the connection between that psychiatric decompensation and imminent danger. And typically in those situations, we are talking with local law enforcement, and if we're making a recommendation for hospitalization, we're explaining that link and working with them to facilitate an emergency detention.
Okay. So where would most of this money go to? I know that 20% of the 5 people for salaries. What else? I didn't. There was y'all submitted 131 pages, so I tried to get in the meat of the information to kind of get an idea of what your greatest financial need would be from us.
Yes, ma'am. So the program as a whole has a budget shortfall as it currently stands, and so some of the funds would be to help us sustain the program for the year, and then beyond that, what we're looking to do is utilize funds to assist with those crisis psychiatric evaluations So being able to get medications going that day on an outpatient basis, and thereby preventing an inpatient hospitalization. That is really our next step, the thing that we're hoping to be able to do more of.
Okay, yeah, because I'm thinking medication would be, consideration if you're having suicidal thoughts. So, all right. So most of the money would go towards. That's what you're hoping to. Do I hear you say you're hoping to maybe make that more of your services, the psych meds and the psych evals and.
Yes, ma'am. We're hoping to make that more of our. We're hoping to make them more available because that can help prevent those hospitalizations. And should we be awarded funding, that is our intention. Yes, ma'am.
Oh, so that's where you're hoping to kind of not really, expand what you can provide. Is that what you're saying?
Yes, ma'am. That's correct.
Okay. All right. Thanks. And I was surprised to say that 25%, fewer than 25% are repeat, needs. That seems pretty low.
So
seems go ahead.
Courtney has a question, so we're gonna.
Okay, Anthony. So let's pretend we're it's next year. You're applying for the grant. You've hit success. Can you tell me what KPIs you're tracking? Because it seems like just as Gloria said, 25%, you're doing on paper awesome. So the next, hypothetically we're in next year, what KPIs or like key performance indicators will you be telling us that you hit if we grant you this funding?
That
specifically for the San Marcos area.
Absolutely. So that is that's a wonderful question. What we are currently tracking is the number of, first of all, number of individuals served, number of repeat crises, the number of follow-ups within 24 hours.
Is the repeat crises how many times they call you, or do you follow up with, like, for instance, do you have an EMR? Is that EMR have interoperability with the providers that you're linking them up with? So you can keep up to date, or do you need money for an EMR as an electronic medical record in case we're unaware? So it's just a documentation system.
We do have an EMR, and we are able to share and receive information through that EMR with other service providers.
Okay. And then you can go, I'm sorry, I cut you off mid-question, but what are other key indicators?
That's okay. Really, those are our primary ones. One of the most important from a state HHSE perspective is that follow-up. What the evidence has shown that follow-up is really critical for sustained outcome success. And so that's been a long-standing key performance indicator for us, is that follow-up within 24 hours and then another one within 7 days. And so
love it.
We typically have 2 contacts within those 7 days. And then some of those individuals end up in our routine services, and some are referred to an external provider. And that's also a number that we track, just the number of people who are connected to a long-term care provider.
Awesome. I appreciate your time. Thank you so much.
So the MCOT follows up within 24 hours and then again in a week. Is that what you're saying?
Yes, ma'am, that's correct.
Oh, okay. Okay. Yeah, follow-up is pretty important.
Absolutely. One of the things that we've begun doing as part of the Texas Zero Suicide Initiative is also sending essentially caring cards 6 months after a crisis intervention to an individual who is seen in crisis. That's, essentially a, thinking of you, hope you're doing well sort of message. And it's written on a postcard. And so that's something that we've recently started doing, and we've had a positive reception to that project as well.
That's so sweet.
Anthony, I have a
Is this-
few questions.
Is this the first, this is the first year you've asked for funding from us?
Yes, ma'am. For this program, it is.
Gloria, I'm actually gonna cover that in a little bit too. Because I did see
Okay.
something in the financials that I wanted to touch base with the board, but we'll save that for after we finish all this.
Okay, sorry, I was just, I wanted.
No, you're good, you're good. Because I saw it on the paperwork and I was right away, I was like, that's the question that Gloria had last week too. So Anthony, I have a few questions myself. I was looking at the Board of Trustees and almost all of them are judges. So is this more of a law enforcement initiative, or is this more of a health services initiative?
This is more of a health and services initiative.
And why is there not more health and services professionals on the Board of Trustees?
That is a good question. I need to follow up with our CEO as far as that goes. I do know that we have a Citizens Advisory Committee board that is made up of individuals and services, families and services, concerned citizens, and they also advise and drive a lot of our organizational decisions. But I'd have to get back to you on the Board of Trustees itself.
Because this is what my concern is with not just us funding something like this, but also if this organization makes recommendations of whether or not somebody should be remanded to psychiatric help or to be committed or something, it seems more pressing for health services people to be in charge rather than 7 out of 9 people being judges. So that was one of my concerns. Is it seems like it would be more of an extension of the law enforcement side versus the human services side. So that was the first one I had. The second question, and you may not be in the best position to answer this one. Looking at the financials, there is a general revenue line item where it's $17.5 million. Where's that revenue coming from?
So in our total budget, we have a contract with the Health and Human Services Commission to be the local mental health authority for that 19 county catchment area. And that's where those general revenue funds come from.
So are those state funds?
Correct. Yes, sir.
Okay. And so I did notice also you have $8 million of federal funding. Do you expect that to be reduced or go away anytime soon?
We do expect some reduction in that. Part of that funding was for the community mental health grant, which is coming to a close at the end of next month.
Okay, perfect. Yeah, those are all the ones I had. Yancy?
No.
No. Joanne, you good? Okay. I think we got everybody right. Clayton, you good? Okay, perfect. Thank you very much, Anthony. We'll go ahead and move on to the next one.
Thank you all.
Thank you for coming.
Thank you.
Thank you.
So go ahead and do the next one.
Okay, our next presenter is Communities and Schools. The program is Mental Health and Wellness Counseling Team, and our presenters are Dorothy Garza and Sharon Vigil.
Hello, good evening, everyone. My name is Sharon Vigil, and I am the CEO of Communities and Schools of Central Texas. Thank you for hosting us. So our mission is centered around nurturing the enormous potential that every student has. We truly believe that students deserve access to relationships, to mental health services, to the basic needs that are their rights. And so I'll tell you that the model that we implement directly on San Marcos Consolidated ISD campuses is called Integrated Student Supports. And so we are the most effective youth re-engagement organization in the nation. Our model is research-based. We support San Marcos School District by providing highly trained, highly qualified, skilled professionals on campus 100% of the time. Our professional staff provides research-based programming. They leveraged partners directly onto campuses. And we do a lot of our work on campuses and in the community so that barriers aren't keeping our students from receiving the services that they need. So our research-based model is centered on full collaboration with our campuses, which means that we every year do a needs assessment on every campus. And so that means that we're speaking to parents, to students, to principals, to counselors, and we're really digging into what the services that each campus needs. I will tell you that we also have a governing relationship with TEA. And so TEA every single year evaluates our program so that we're meeting outcomes for the state and for the area. Additionally, TEA has named us the best practice program to provide mental health, academic recovery, and community engagement. So we currently serve 11 campuses in the district. Our engagement with the district was propelled by the Youth Risk Behavior Survey that was conducted by Texas State University. As you may be aware, in 2021, there were 4 youth deaths by suicide, and there has been a recent increase in fentanyl usage. And so this has prompted our full-scale support of San Marcos ISD. And so we are in every single campus with full-time staff on campus, and we've saturated the entire district. So a little bit about our services, and I'm going to pass it on to Dorothy here in a bit. But last year we served 5,632 unduplicated students. 881 of those students were intensely case managed. So students needed support with self-regulation, making healthy choices, or anxiety. We lead grief and loss groups. We help students with gaining their confidence, managing their behavior. We provide mentors, parent engagement, and basic needs. Last year, we call this bridge funding. We provided to families from San Marcos $45,888 in direct financial assistance so that they can pay a bill or not go hungry and be able to buy food, or if students needed clothing items. In addition to what we provide on campus, we also leverage resources. And so last year we brought in 9 partners to the district. We brought in 13 volunteers. Full-time AmeriCorps members were 15, and mental health interns were 7. So for every dollar that the city is going to provide, or the city is for every dollar that the city of San Marcos provides, CIS goes out and leverages $75.66 additionally. And we do that through our development team. So we have funding from foundations. We do receive state funding. We also have very generous donors that support CIS. So that's a little bit about our model, and I'm going to go ahead and pass it over to Dorothy. Oh, is she not? Oh, yes, she's here.
Yeah, here I am. Thank you, Sharon. So I'm going to speak specifically about the mental health and wellness program. Again, my name is Dorothy Garza, and I'm the Senior Director of Mental Health and Wellness with CIS. Last year, we started a pilot to focus on the more intensive mental health needs that were coming up to our awareness with students returning back to campus post-COVID. And so we have a 3-pronged approach to supporting students. One, and the one I'll talk more about, is our short-term intensive counseling. So we have licensed clinicians who are providing short-term intensive mental health counseling to some of our highest need students that are in CIS, our CIS case managed students. And with the idea that they are supporting crisis stabilization and transitioning into either back to integrated student supports, a crisis has been stabilized, or onto ongoing supports in the community. They're working with the schools, they're working with the families to help that happen, but they are primarily focused on the work with the children. We also are providing mental health services. So we're building toolboxes, not only for our program staff, but for our partners, and with the goal of adding parents to that. We also have an extensive an internship program that serves all of our school districts with university students who are learning to work with students and families. So I'll go on to our mental health and wellness program, which is our focus. These are, like I said, licensed clinicians who are serving our highest need students. They are trained in a variety of modalities so that they can meet the needs of those students, whether they are first graders or whether they are 11th graders, to address trauma, anxiety, depression symptoms, grief and loss. Those are some of the higher needs that come up, and associated emotions and feelings along with that. We have 8 to 10 sessions. We are serving all of our school districts, but we are serving San Marcos with some exciting potential for next semester. So we are looking forward to increasing our layered supports for San Marcos CISD.
So we're gonna open up the floor to questions. I have a few. So, I was reading the packet over here, and did I read correctly that there's been a 51% increase in girls attempting suicide since 2021 in San Marcos?
That is true.
Okay. So, what's the best guess, I guess you could say, of what caused such high increase in 2021?
Do you want me to take that, Dorothy, or?
You can start and I can complement.
I will say that COVID has impacted all of us. And we have been, we are people who need socialization. And we know that post-COVID, we had a lot of individuals who were now expecting to fully transition back into normal world, and that really causes a lot of anxiety, that causes depression, that really has affected and impacted our students greatly. I will also tell you that some of the students that we work with when we go into lockdown, sometimes their homes weren't safe. And so now there is no place to come to get services, to get treatment. Schools were closed down. And so what you see is that there was a barrier of gaining access to the services that they needed. And so then now, not only do we have students who have been isolated, potentially were in homes that may not have always been safe, and then they were isolated. And so now we're layering the impact, and we're really layering needs. And so
like retroactively.
And so that is, obviously we can't survey them and talk to them. And so this is a lot of guessing. But when we look at the context of what was happening in the United States and the world, and when we understand the home life of our students, that is our best guess.
Yeah, I would agree. And one of the things that that Sharon mentions is that with the closing of the schools, that really impeded the early intervention and the catching it earlier so that we didn't get to those crisis numbers. But nationally, that trend was already happening pre-COVID. COVID made it worse. And so now we are recouping. We are with a higher acuity of need. And so that's, I think, partly what's explaining that. And then there's just been a lot of efforts. I think it was mentioned in the other presenter that Project Aware, and there's a lot of zero suicide efforts that's getting out so that people are reaching out more for help. So we are seeing, and it's a good thing.
Okay. Second question was, did you have a question, Courtney?
I was gonna say, I don't know if I should excuse myself, because I was part of CIS as a student, so there may be a conflict of interest on me voting for this. I don't know why. I thought it was computer information systems. When I saw CIS, I thought something else, but they're great. They're the reason they were awesome for me. So I'm not sure how I'm supposed to go about that because I didn't report that.
Yeah, you would have to, you can definitely excuse yourself because we have enough for a quorum. But yeah, since you work with the organization, it does create a.
Okay, just wanted to let you know, but thank you guys for existing. And
so Courtney, you were not an employee of CIS. You were a student of CIS. Is that correct?
I was a student, yes. I was in your LGBTQ groups at Lehman High School.
Yes.
Yeah, it was really awesome. They had a nice space. It was like a little cave, and we had group like every Thursday, and they would pull us from classes. And I was actually in in-school detention, not going down a good path. And like I ended up going to MIT. So like that, I can't. My story, like I'm totally biased, so I wish the best for you guys.
Listen, that's the best. That is, I'm happy, and I would like to meet you. I'm gonna send you an email. Sorry.
Okay, that's a testimonial. So there you go. Bye.
Clayton, go ahead. I have a couple other questions, but go ahead with yours.
Okay, thank you. I see in the implementation section that you're gonna use these funds to help fund 3 different positions as well as transportation and mileage. If you could put it into percentage wise, how much of the money will go towards the mileage? You know, like 50, 60, 30%, if you could guess.
If I could guess, probably 2%, if not less. Our people are our programs. We know that when students are connected and when they're in relationship, they're successful. And so you will see that 95% of what we're asking you all is going directly to services.
Okay, thank you for the clarification.
Yeah, and we are strategic because my clinicians are quite skilled, and them driving back and forth is not the best use of their time. So we strategically recruit and hire so that they aren't spending the majority of their time traveling.
Awesome, I appreciate it.
So like I said, I had a couple extra questions. First, another one, I read that there were 4 suicides for San Marcos ISD. Was that over a whole year or a few months or whole year?
It was in 1 year. It was Texas State, it would cause Texas State to study San Marcos Consolidated ISD. It was the trigger of those 4 suicides in 1 year.
And I noticed that the program says you've been serving Texas or the San Marcos since 2021. Was there no program whatsoever from this entity before then?
There wasn't. We were actually contacted by Texas State. We were contacted by your local government and by the superintendent once those 4 suicides happened to come and provide support.
Gotcha. And then the last question I had was, what does it look like to provide services to, say, an elementary school kid versus maybe a middle school or a high school kid from your organization?
Yeah, so what I will tell you is that all of our students are provided an assessment called the Student Health and Wellness Assessment. That helps us target the exact need that that student has. Additionally, what we do is we do a strength-based needs assessment with the families. So I wanted to say that we really focused and we're really individualized. We are not a cookie cutter program. And so the programs look a little bit different. Dorothy, would you like to talk a little bit about that, or do you want me to chime in?
Yeah, no, I can speak specifically to the mental health program. As I said, our clinicians are trained in a number of different modalities. So a student who is a third grader who has experienced trauma and is having difficulties regulating their emotions and are tearing up the boards, or something triggers them and they are acting out, or they're acting in, they shut down, then our clinicians who we get approval, consent, and we do another assessment, which is a much more thorough psychosocial assessment to find out what else is contributing to those behaviors, and then developing based on their interest, based on the kind of need, they're developing treatment plans for those students and monitoring that. We do as clinical staffing, and we're sharing ideas, that kind of thing, for that plan. We are also working with the families right from the beginning to transition. Fast forward it to a high school student who may have experienced those same kinds of issues a lot earlier and are now struggling with anger management, or maybe some substance use added onto that. We don't necessarily address this. We don't treat substance use, but we're going to talk about the coping skills and the other issues that may be going along with anxiety or depression types of symptoms. And so again, they're doing a psychosocial assessment, and they are coming up with the treatment plan that pulls from the best practices that are associated for that age group and for those kinds of issues. And they're working with the family in most cases for ongoing care. We've got 18-year-olds. And so with the 18-year-olds, the 17-year-olds, we are doing a lot of teaching about how they're going to access services as an adult.
So I'll give you some examples. So we do stand tray therapy in some places. Additionally, we might be playing a Uno game and processing an experience with a child. We do something called lunch bunches at high school, where students get to come during lunchtime and we are helping them process. Additionally, I think you heard from one of your fellow leaders that they were in a self-reflection and self-identity group, where students who are potentially needing that support are coming together, and with our coordinator or our mental health person are going through situations and talking about it and holding each other accountable. So we also do a little bit of play therapy and art therapy, where we are using different modalities to help students process through activities. So those are some examples of some of the work that we do right on campus. Students do not have to drive to find this resource. And so that's why we say we are a preventative work, because we are seeing the signs early on and helping students self-regulate, creating an environment where they can identify different behaviors, so that we're not having them then interact with law enforcement later.
Perfect, thank you. Any questions, guys? Clayton, Gloria, Joanne? Yeah, no. Okay, well, thank you very much. We appreciate your time and your presentation.
Thank you.
Thank you.
And our last presenter, Access Network, was unable to attend this evening and will be rescheduled for a later date. So sure, the floor is yours.
That's why we're so far ahead, because we have one less presenter?
Yeah.
Okay. Okay, so we're gonna move on to number 6, discussion items. We'll now hold a discussion among the board members. in programs, agencies, and applications for the purpose of clarification, comparison, evaluation, and assessment. Discussion is public, however, it is only among board members. This time is meant to free flow conversation, but please make comments succinct to allow time for all board members to share if they wish. Discussion being facilitated by Cindy Castillo, Grants County Specialist. Cindy, go ahead.
Just as a reminder, this time is just to consider and discuss these presentations, what makes them memorable. Also considering how you feel about the need for these programs here in San Marcos.
So first thing I have, Gloria, when you're asking about the, what's it called? The Hill Country MHDD centers. So if you look at the funding history, they usually actually be the Shibe Opportunity Center at the very bottom. So when you guys are looking at the sheet, they requested 41,000 in 2020, and then 29,000 in 2021. And then it looks like they didn't request anything in 2022. And then we had 20,000 in 2023, and then 115 for this year.
Yeah. Well, but the Shibe set, this is specifically MCOT, and Shibe is much more than that. So they might be under the umbrella of Shibe, but it's specifically MCOT, and this is the first year they asked for money.
I think it was the other way around. I think Shibe was under the umbrella of the other one. Because yeah, on their presentation, it actually talks about it. Let me see if I can pull back up.
I don't think so. Because Shibe used to ask for funding, and I don't think they've done it in a couple of years. 2-3 years.
Well, and that's what I'm saying is that they changed the way they request the funding.
Yeah, they changed the verbiage. They changed the wording.
Yeah, I think it was under. Oh yeah, so under council priorities on their package, it says their office in San Marcos is the Hays County Mental Health, which is the Shibe Center.
Right. Right. Well, and I mean, I'm MCOT for in general for more cities are trying to utilize MCOT for a variety of reasons. But I'm just not clear on what the current amount of money being asked for would go for. I hear them saying, well, in the future, we want to provide more medications and psychiatric interventions and, all this other stuff. But I'm still thinking that a good portion of this money is going, well, where is the section that says, what specifically do you want this money for? What specific, no? And I couldn't find it, like what specific use would you have for, do you want to use this money for? And I didn't see it. I'm a big MCOT fan, but 115K is a fifth of what we got. So, I'm not the only one that, looking at that number.
Yeah, absolutely. It does say that the on implementation on bullet point 1, it says funds will be used to fund 20% of each position on MCOT. And I agree with you on that.
No.
I was thinking we shouldn't be funding 20% of each position that they have, But Clayton, yeah.
Well,
Or,
yeah, and but we're talking about and again, qualified mental health professional. What exactly is their title other than, what I mean? Their expertise. I get that they have to go through rigorous training and all this kind of stuff, but I still am a little vague about what their qualifications are.
Yeah.
Yeah, and
Go ahead.
yeah, I'm sorry, go ahead.
No worries. No worries. Kind of in that same vein as Gloria was saying, I mean, obviously I was a fan of all 4 programs, but in terms of dollar wise, the first program, the Child Protective Board, and the fourth one we heard from, the Communities and School of Central Texas, I really feel like with the amount of money requested, a lot of good could go that way. So I just want to point that out as what stuck out to me most.
Yeah, to piggyback on that, did you say the combined action or combined community action?
Yeah, Community and Schools of Central Texas and the Hays County Child Protective Board are the 2 I was referring to.
Yeah, so I agree with you on that. With the Child Protective Services, I've only given a perfect 100 to 3 organizations, and they were one of them. And then the Communities and Schools, I rated it really high at 95 too. Because did you guys notice that we've been getting a lot of different mental health services?
Definitely, yeah.
Yeah.
So that's something we'll have to consider when we start discussing the allocation. How best to, like, which one stood out the most to you, and which one do you think is the most effective one? Because obviously, I'll tell you, there's one. I'm not going to tell you which one yet. There is one that they're requested for quite a bit, and I'm leaning towards completely giving you 0 out on that one. Because again, we don't have to fund every single one of the requests, because we're gonna have to move some more eventually, you know.
Right. And back on the MCOT, I'm not, the 20% of the salaries that they're talking about, I'm not sure that it would still amount to 115K. So I'm still a little vague as to, how it's being utilized. I don't know. I guess if you're following up, how on multiple crisis cases, and each one gets a 24-hour and a 7-day follow-up, that amounts to a lot of time, and time equals money. So, all right, I'm not going to belabor. I'm done belaboring the point about that.
Yeah, I think on that one, that's why I wanted to bring up the funding from the Shive Center and then their funding from previous years, because I think we should, in the future, we should keep it somewhere along the same lines. They got 41,000, 29,000, and then 20,000, and then it jumped to 115, which is more than the combined 3 years that the city funded them. So I'm thinking more along the lines of, again, when we get to the dollars and cents, we'll be thinking somewhere along those lines too, 20, 30 at most. Yeah, the school ones were, especially the communities and schools, that one, if both the city and the university requested it, they're not even asking for that much. They're only asking for 12,000, I think it was.
Right. And it literally says that money is going to be used for salaries.
Yeah.
Where it says, how exactly will these funds be used? I like it when they respond directly to that question, because that's what our mission is. How exactly are these funds to be used? So that should be in every single handout, or
it'll be clearly answered.
Yeah, exactly. Okay, perfect.
I think everybody asked me 4 questions.
Yeah.
So I didn't really have much to ask or say, because I felt that it was pretty much answered. Whatever questions anyone asked, people were able to answer the questions pretty clear and straight to the point.
Yeah. What is this, the 4th week that we do?
Yeah,
3rd week?
the 5th maybe? No,
they didn't even
4th.
say how exactly are your funds to be used.
We missed the
Yeah,
first one.
like, so I think we're getting very comfortable of like what questions to ask and what specifically we're looking for. Okay. Any other questions, comments? Joanne, you good? Okay, cool, perfect. Clayton, you good?
Yep.
Okay. And Gloria and. Okay, cool.
Huh? No, I'm just, yeah,
It's still reading. Yeah, it's, some of these packets are incredibly detailed. And-
yeah, I mean, sometimes you just gotta have a real piece of paper to, you know? I mean, I get the whole need for the stick, but you know, you can't make notes, you can't look, you can't do this, interact and look at the data without a piece of paper. So
Definitely.
for me anyway.
Okay, we're gonna move on to item number 7, reports. It's now time to receive any updates from board members on any activities since the last meeting. Anybody have any updates for the group at all? No? Good. Okay. So we're gonna move on to the next item, which is future agenda items. Board members may provide requests for discussion items for a future agenda in accordance to the board's approved bylaws. No further discussion can be related to the topics proposed until they're posted on future agenda items and in accordance with the Texas Open Meetings Act. Anybody have any requests for future agenda?
No.
Nothing? Okay. We're gonna move on to a question and answer session from press and public. It's an opportunity for the press and public to ask any questions related to this agenda. Staff, anything?
There.
Nothing, okay, perfect. And item number 10, adjournment. Thank you everybody for participation. Do I hear a motion to adjourn the meeting?
Motion to adjourn.
Okay, motion to adjourn by Yancy, any second?
Second.
Okay, so Clayton, we get a second for Clayton. All in favor of adjourning, say aye. Any news? Okay, so we're gonna adjourn the meeting at 7:55 on September 28th, 2023. We shall see you guys next week. Take care.
Okey dokey.